Parkinson disease. Parkinson disease is chronic progressive degenerative disorder that involves the basal ganglia that involve involuntary muscle movement. The causes of Parkinsonism is the idiopathic Parkinson disease is the most common type. The encephalitis ischemia is also a cause of Parkinsonism. Now, there is trauma, repeated head injury is also known as punch drunk syndrome, and genetic predisposition like mutation in gene like LRRK2, SNCA, or PARKK. The main pathogenesis behind the Parkinson disease is the striatal system is involved in voluntary muscle movement. Like there is an imbalance between dopamine and acetylcholine neurotransmitters, either an increase in acetylcholine or a decrease in dopamine level. Then clinical features are idiopathic Parkinson disease. Onset occurs between 45 to 65 years of age. Distribution is equal in man and woman. Most cases are sporadic, and incidence increases with the age. General features are expressionless, mask-like face, monotonous speech. There is patient also having constipation. Tremors are like usually first in fingers, then thumb. Resting tremors, that is 4 to 8 per second, that decreases with the voluntary movement, and pin rolling movements. Then rigidity types are cogwheel type, plastic lead pipe type. Then patient having hypokinesia, gait or posture reflexes. Eye signs in Parkinsonism like reflex blepharospasm, retraction of upper lid, that also known as Collier's sign, red eyes, cogwheeling of eye movement, keratitis from dry eye, infrequent blinking, patient handwriting or micrographia, in which disease is micrographing. For how to investigate, there is no specific test to diagnose the Parkinsonism. Diagnosis is entirely based on the clinical judgment of the doctor. Like there is cardinal signs of Parkinson disease are rest tremor, rigidity or bradykinesia. The presence of at least two of these signs on physical examination is grounds for a clinical diagnosis of this disease. The most commonly drugs used in Parkinsonism is MAO-B inhibitor like selegiline or rasagiline. The side effects of these drugs are insomnia and confusion. In Parkinson disease, we instruct the patient to avoid tyramine containing food, that is cheese with MAO-B inhibitor, which can precipitate the hypertension. Now, we can also use central anticholinergic like procyclidine, trihexyphenidyl. Most commonly used drug are trihexyphenidyl. Benztropine is the drug of choice for drug-induced Parkinsonism. The side effects are dry mouth, constipation, blurring of vision, urinary retention. Then we can also use dopamine agonist like levodopa. Side effects are on-off phenomena, that is psychosis, somnolence, confusions, hallucination. We can also use dopamine agonist are amantadine, ergot alkaloid like pregolide, bromocriptine. We can also use comet inhibitor like tolcapone, entcapone. Continuous infusion of levodopa. Intrajejunal infusion of levodopa gel avoids problem of gastric emptying. Then we can also do deep brain stimulation, high frequency stimulation of selected areas like subthalamic nuclei or globus pallidus. We can also do surgery like thalamotomy or pallidotomy, transplantation of fetal midbrain dopaminergic cell into putamen of patient. Then we transplantation of autologous adrenal medullary tissue or treatment according to the severity of the disease. In mild or early cases, less than 60 year, we give the anticholinergic, or more than 60 year, we give amantadine. For severe or late cases, we give the pramipexole or levodopa, AD or comet inhibitor or MAO-B inhibitor. Like Lewy body dementia is there is Parkinson or dementia features. So that's all about the Parkinson disease.